This is a demonstration of an insertion of a Foley catheter, otherwise known as a retention catheter, on a male client. I have done my standard steps, identified my client, gathered my equipment that I will need, and I have my bed protected with a Chuck's pad, could be a cloth pad also. And I have my patient covered as best I can for this procedure. So what I will do, I'm going to do this a little bit different than we did the female cath. It's just a different way to set it up. You can set it up the way we did for the female, for the male, and you could set it up for the female the way I'm doing it for the male. Did I say that right? Did that come out right? Yes. Okay. So I will open my box and use this bag again for things that I am going to discard. Eventually it will go in a biohazard bag. I'm going to do pericare again, and I want to be sure that the folds are all clean before I even start. If this man is circumcised, I will pull the foreskin down, pull it back, clean around the penis, and pull the foreskin back until I'm ready to put the catheter in. On men, sometimes there are folds even though there have been circumcised, and so that all needs to be washed and dried also. So pericare first. Can your STNAs do that for you? Absolutely they can. In this, if I had done that myself, I would have had gloves on, and I would now use a liquid hand sanitizer. This I do not need. It was just a listing of what was in my kit. And in this instance, I'm going to bring my whole box over right onto the bed. I will open the first flap, pinching away from me first. Pinching and pinching in case they fall back, then I've not contaminated my field. And the last flap will come toward me. I have another drape here. I think what I have on top here is my drape. In this case, my gloves are buried. So when I lift this out, I want to know where I have contaminated this drape. And although ideally the shiny side goes down because I've contaminated this part, I'm just going to put the shiny side up. And this drape is just going to extend my sterile field. And I'm not going to adjust that at all now because I don't want to touch it anywhere. If I were to adjust it, I would touch it right up here. So now I can get my gloves out, and I'm going to bring them over here to put them on. The most difficult part about these catheters, catheterizations, is up and back, is being sure that you're maintaining sterile technique. Up and back. And now I can adjust this in underneath the penis. And in this case, again, I have a fenestrated drape to extend my sterile field. You can use this or not use it, and you'll get a feel for that. If you don't use it, I would lay it up on the abdomen, and you can use it to cleanse the perineal area when you're finished. But we'll go ahead and see how this works with this. Again, I'm careful not to contaminate. Now I'm ready to set up my kit. I can work freely within this because this is all sterile. I've got a nice size sterile field. And I'll open up my swabs and get them ready. I will open up my Vaseline, or my lubricant. It's not Vaseline, it says water-soluble lubricating jelly. And what have I done with my my swabs are there. Okay, so now I'm going to check my balloon on my catheter. And I will insert all of the fluid that I have. And this balloon is intact and it's not breaking. So I've checked my balloon. I'll just withdraw all of the solution. Again, I've left my bag right in my box. Insert this into my lubricant. And now I'm ready to use my non-dominant hand to clean the penis. If this is the point in time that I would pull the foreskin back on an uncircumcised male. I'm going to hold firmly at the base of the penis. This seems to be less stimulating, but if the penis becomes erect during this, just go ahead and proceed with your procedure. On a male, I'm going to start at the meatus itself, cleanse, and then go around down the shaft until I reach my gloved area. Drop. And I'm going to do the exact same thing 3 times. Now I'm ready to insert. And some of that swab got on my sterile field right here. So because I know that now that's not sterile, it's wicking up, I'm going to be sure my catheter doesn't touch any of that area. I will now insert. When I'm inserting, I am not contaminating my sterile hand on the tip of that penis. So, and this, don't worry, your catheter and the bag will come right along with you, so don't worry about having that come out. With the male, we insert this catheter all the way to the Y port. And from experience, I'm telling you that this really helps to be sure that you are in the right place. I should be seeing urine now. In this instance, I can drop my hand down to hold that catheter so it does not coming out, migrating out. I will insert my balloon, or inflate my balloon with this liquid. And I've got to hold that in. I'm going to gently tug on my catheter and then remove my syringe. Doesn't necessarily have to be done in that order. In this case now I'm ready to remove my fenestrated drape, and I can get my client covered at this point in time. And I will affix this to this leg band, and again right at the Y port so it doesn't slip. This then is, I'm going to check to be sure that this is closed. This will go on a non-movable part of the bed. This always needs to be lower than the lever of the bladder because it drains by gravity. I will do pericare because I will have used betadine, and that needs to be washed off, and be sure my client is comfortable. And that would be the end of